All right, let's take a couple of minutes and talk about all of those free perks that come with Advantage plans. And the first thing that we all need to understand is that nothing is free. It's paid for by someone. And when it comes to Medicare, that someone is usually taxpayers. Advantage plans remove the financial risk from the Medicare Part A and Part B books by taking on the responsibility of those claims. But they don't do this for free. Advantage plans work by receiving dollars from the government for each person that they insure on their plans. The dollar amounts that insurance companies receive vary by several factors, including the quality of the company and its star ratings, the location, the health of those that they insure, and I want you to remember this one for later, the health of the individuals insured matters. I'll reference this in a bit and you'll go, oh, that's why. There are other factors as well, but the insurance company itself takes these dollars and then they allocate them to various benefits. So as we go through these, know that if you've heard of a plan that has some crazy weird benefit or higher dollar amounts, it's likely because for that plan, that insurance company moved dollars away from something else to focus on whatever the benefit is that is standing out. Now, these insurance companies are regulated in a way where they must cover certain things in certain ways. There was another crackdown on this with changes implemented for 2024, so there are standard things that you'll find in Advantage plans. But the real marketing of these plans lies in the other benefits that are not as consistent. But to understand those, we have to understand the core dollars connected to the benefits of Advantage plans, and there are 4 main cores. These 4 carry the more important insurance coverages with them. The plan's network is the first core functionality. What facilities and doctors are in network with this plan? This is huge when it comes to Advantage plans, so make sure that you verify that the providers that you want are in network. And if you haven't been to them before, make sure that they are seeing new patients as well. Copays and coinsurance amounts are the second core functionality. How much are you going to pay out of pocket for various hospital and medical services that you could potentially use? These copay and coinsurance amounts are controlled by the insurance company. For example, with one, you may have a $20 copay every time you see a specialist. For another, it could be $30, and another, it could be $50. Same with basically every other service. The insurance companies set these copay amounts where they want, making some lower than their competitors if they feel it's important, while others a bit higher than competitors to offset the lower copays. So this is one lever that insurance companies can pull to adjust margins. The next would be the maximum out-of-pocket. This is a big one because it is the biggest dollar amount that people could face, your highest risk when using the plan within the plan network, and therefore it is a number that people immediately look at when considering Advantage plans. The window of maximum out-of-pockets that we've seen for 2024 range from as low as $500 for the year or as high as $8,850, again, if you stay in network. It goes without saying that this is another lever that insurance companies can pull to hedge the risk. Location matters here. Plans in certain areas are able to offer lower max out-of-pockets because of funding differences in locations. Now, prescription drug coverage, dental, vision, and hearing are all bundled into one group here for the last of the core benefits I'll mention, and again, they vary dramatically. Some Advantage plans aren't particularly aggressive with dental and vision coverage, and it's pretty meh. Others invest heavily into those benefits and try to attract people who are looking for more dental or vision work. So those are the 4 core benefit areas that probably deserve the most attention when considering an Advantage plan. But these aren't the main perks mentioned in commercials and ads, so let's go over those. And it becomes a bit of a mess here because they are all over the place, but gym memberships are very common. They have different brand names tied to the fitness programs connected to Advantage plans, names like Silver and Fit, Silver Sneakers, and others. They give you access to a network of gyms across the country as well as virtual class options. This really is a nice benefit for those who like to exercise at the gym or local pool. The next would be a flex card. There are different brand names for these as well, but they all work in a similar way. You get a prepaid debit card that is loaded with a specified dollar amount each month or more commonly each quarter. And you can use these dollars to pay for certain approved items. Some plans keep it broad where you can use these dollars for quite the variety of things. Others will have more specialized buckets, if you will, for things like over-the-counter items or groceries or active lifestyle items. So that's something that you'll want to verify with the plans available in your area. There are some other perks in a lot of these plans like meals after hospital stays and rides to and from doctor visits, services where you can have someone come visit your house as a companion. We've seen plans with pet insurance and other random things, but the last perk we'll cover in this video is going to be that Part B buyback. The benefit where your Advantage plan will actually give dollars back to you to lower your Part B premium amount. The dollars here vary from a little, like $5 to $10 per month, to we've seen as high as $100 for specialized groups of people in certain areas. Now, there are 3 very important details with all of these extra perks that we've discussed that trick or confuse a lot of people into calling those national call centers from the commercials touting all of this free stuff. Number 1, These perks are not available everywhere. TV commercials, internet ads, phone calls are blasted everywhere in hopes of generating calls and traffic. But that does not mean that these plans are available everywhere. Check with your agent. He or she will know about these plans and the trade-offs to them. Remember, if I put more dollars towards a flex card, those dollars are coming from one of those other levers that we discussed. Number 2, the dollar amounts are all over the place. If a Part B giveback is available, the number you hear on the commercials likely isn't the actual number available to you. Same goes for over-the-counter benefits, flex cards, grocery benefits, and others. So why do you hear about plans with thousands of dollars available for people to use on groceries or other things? In general, which means there are exceptions, but in general, a couple of things are happening with these. It's important to understand that there are plans specifically designed for those with lower incomes. Think Medicaid. These plans are Advantage plans, but they have different funding mechanisms and often have higher benefit options available to help with things outside of healthcare for those with low incomes. So when you hear or see someone talking about high dollar amount benefits that they are getting to buy free stuff on their Advantage plan, often when we start going into more details, they qualify for these plans designed for those with lower incomes, which is great. But for those who do not have lower incomes, high dollar free benefits look great and may lead you to call to learn more and then be steered somewhere else. Another big asterisk with these high dollar plans involves what I told you to remember earlier. The health of those insured by Advantage plans impacts how many dollars the Advantage plan receives from the government. So if you have a chronic condition, you are a higher financial risk to the plan, and therefore an Advantage plan will receive additional dollars from the government to help offset that risk and potential costs associated with less healthy individuals. This means that there are Advantage plans that get more money to allocate to higher benefits, but you need to qualify with a chronic condition. And by submitting the health assessment to show you qualify, it gets the insurance company those additional dollars for the plan. Here's that oh moment. And I'm not saying that an insurance company shouldn't receive more dollars for taking on the risk. I am saying that if someone does not have the health profile to qualify for these plans, but then sees all of the advertisements running everywhere that do not clearly mention the hoops to jump through to qualify, it prompts a lot of people to call who can't get the plans, and then again, they're steered to other less fitting plan options offered by the call center or pestered incessantly if they say no, and then you know the cycle. And when I say these high dollar Advantage plans, it's the I get thousands of dollars a year to spend on groceries and stuff. Many what I'll call regular Advantage plans will have an over-the-counter benefit of $30 to $60 per quarter or dollar amounts in that range, but a couple of $1,000 over a year, usually something else is going on there. So just pause for a second on these high dollar plans advertised. Work with your agent who should know you better than a call center or a marketing agency. Okay, the last very important detail with all of the free perks of Advantage plans. Think about it this way. In your area, you have certain companies competing for your business. They all have to check certain boxes to even be in the running for your attention. If the average out-of-pocket maximum for Advantage plans in your area is $3,000, but then one company has an $8,000 out-of-pocket max, they've kind of eliminated themselves from the running. So with a lot of these benefits and perks within the same geographic area, they will be relatively similar. There will be a more narrow range of copays, max out-of-pockets, etc. But with the other perks, they can make small changes, meaning a $10 change to a couple of $100 change per year to them versus a couple of $1,000 change per year tied to the bigger core benefits. There are so many levers in the core benefits that can be pulled because they get lost easier in the benefit grid that has all of the copays and coinsurance amounts listed for all of the services. While the extra perks are much easier to pull up, point at, and say, look, we offer $80 more per quarter for over-the-counter benefits, but your outpatient surgery copay is $100 more than the different plan, and your specialist copay is $20 more than a different plan, and your out-of-pocket max is $1,000 more. While this hand is moving over here, another lever is being pulled over here. This is just my personal advice here, but this video is broken into two major sections, core benefits and extra perks. The core benefits in the first part of this video will have a much more important, long-lasting impact on your finances, health, and peace of mind than the extra perks in the second part of this video. Your network, co-pays, co-insurance amounts, and out-of-pocket maximum, drug coverage, dental, vision benefits, hearing, are where your foundation for this decision should be, not a gym membership, not a couple $100 per year for over-the-counter benefits. If you are considering one of these plans, work with your agent to go into the details of the trade-offs of one plan over another. Okay, this is the last part that I reserve as a test to see if people made it this far, because even though we aren't an enormous YouTube channel, I get hundreds of pretty intense negative comments for even mentioning Advantage plans in a semi-positive way. In my mind, this video was made for those of you who already are on Advantage plans, who are seeing ads and you're trying to make sure you have what you need, or maybe you're hearing about all those other perks that you're missing out on that are making you consider Advantage plans over something else. I don't care if you choose an Advantage plan or a supplement plan or neither. I care that you are happy with your decision. And if you made it this far, I've already used animals as a code phrase in other videos, so we're going to go with books for this one. If you leave a comment and include anything related to books, we'll know that you at least made it to this point. I love reading books, and we have a company newsletter that I send out every month with Medicare and Social Security tips, a book recommendation or two from books that I've read recently, and personal stories from my life that have nothing to do with Medicare or Social Security, just a look into my real life. You are more than welcome to join this if you would like. I have a link to that in the description. We don't market with this newsletter. It is literally 12 emails a year, one each month, unless there is some major Medicare change. Okay, from here, I think you might enjoy this video quite a bit, so I will see you over there.